Yeah, thank you, ladies and gentlemen. My name is Victor Obasuyi, and today I'm going to be talking about cataracts and the eyes. Surprisingly, most times after the eye examination, and I give patients the prescription. The first question they ask me is, "Doc, do I have cataract or glaucoma?" I decided to shoot this video to explain what cataract is about and the basic things that everyone should be aware of. Cataract is part of the normal aging process. Everyone will get it with time. So there's really no need to, it's one of those, you don't have to panic over it. It's like gray hair. So long as you live old enough, you will get it. The time everybody gets it varies. And just like gray hair again, some get gray hair at a much younger age. Some get it when they're much older. There is no, although there's a tendency in families for a lot of people to get gray hair when they're much older, but there's no rule that says your brother has gray hair at 40, you probably be 40 before you get gray hair. It is not unusual to find gray hair in kids. The same thing with cataract. Younger people can have cataract, but most people get it when they are much older, same like gray hair. So there's really no need to panic if you're going to have cataract or not. You will get it if you live old enough. Now the question is, what exactly is this thing called cataract? As we get older, the natural lens in the eye starts to become cloudy. When the lens gets cloudy, less light gets to the back of the eye, so vision becomes blurry. It's like when you look through, you have a dirty windshield and you're trying to drive. Obviously, the vision will not be as good as when you have a very clean windshield. That's the closest analogy that I can use. So as we get older, every one of us, the lens becomes cloudy. It gets worse over time till it gets to the point where it starts to impair your ability to carry out your daily routine. And that is when cataract is recommended to be taken out. Some people, as soon as you tell them they have cataract today, the next day, "Doc, I want to take it out." We have to remember that every surgery has its inherent risk. The advantages have to outweigh the risk for you to benefit from the surgery or for the surgery to be recommended. Not every surgeon in their right frame of mind will jump into performing cataract surgery when it doesn't impair the person's ability to perform their daily functions. Another question I get asked is, can the surgeon, because usually when it gets to that point, I say, okay, I'm going to refer you to a specialist. The fear that most patients have is as soon as they get there, they're going to do the surgery right away and they'll be compelled to do it. No surgeon can compel you to have cataract surgery. Cataract surgery is a decision that you make as a patient. You have the right to say, yes, I want to have the surgery done. No, I don't want to have the surgery done. No surgeon, no doctor can compel you to have cataract surgery done. The only time where it is not within your jurisdiction to make that decision is if maybe you drive for a living and the cataract is such that it's beginning to impair your vision and your vision is below the driving limit. Then, because you share the road with other people, your doctor is obliged to report to the Ministry of Transportation that Mr. A or Mrs. A vision is below the driving requirement. The Ministry of Transportation will now write you a letter telling you that there's information that says your vision is below the driving requirement. Go and have your eye tested and send them a report, or have the doctor send them a report. They give you a form that the doctor has to fill. So you can probably seek a second opinion, and the doctor, after the examination, will usually write your vision, as in your visual acuity, and your peripheral vision. Those are the two things that they need. So if the other doctor also writes that your vision is below the driving requirement, or your visual field is below the requirement, the driving requirement, then the ministry will suspend your driver's license until you rectify that problem. Even at that, they cannot mandate you to do the surgery. They can only suspend your driver's license. So it is now up to you. If you know you still want to continue driving, then you have to have the cataract surgery to remove the cataract. So this is the tricky part of the situation. They cannot compel you to have surgery, but they have the right to suspend the driver's license in order to protect other road users. Now, when it comes to the surgery itself, patients are most times afraid, they see this as a big surgery. Again, cataract surgery is not a big surgery. It's a day surgery. It's not the type that you go into the hospital and you sleep, you're there for a week. No. The surgery is done the same day and you're gone. For most people, the next question they ask is, because during cataract surgery, what the surgeon does is to take out the cloudy lens, the natural lens, and replace it with an intraocular lens. The intraocular lens is usually measured such that it will compensate for your glasses prescription. So most times when after cataract surgery has been done, the patient, he or she, can actually function without glasses for the distance and just need only reading glasses. But again, it is not guaranteed that you won't need glasses for vision. The surgeon they take the measurement for the intraocular lens to try to compensate for your distant vision. It's not guaranteed that after the surgery, your distant vision is going to be 20/20 because you did not do laser vision correction. So this is another thing to be aware of, because a lot of patients come back and say, Mr. A did cataract surgery and now doesn't need glasses for distance. Why do I still need glasses for distance and reading? So that's what we should understand. Then when it comes to the intraocular lens itself, there are different categories. The basic one is just enough to replace the lens that you had before. That way you don't have to wear those Coke bottle glasses on which most cataract patients used to wear in the past. Then that is because the actual lens in the eye is a minimum of +10. So if they take that lens out and don't put an intraocular lens, you have to wear glasses with a lens power of at least +10, which is why we used to see cataract patients in the past with Coke bottle glasses. But thank God for technology. Now that we have the intraocular lenses, it compensates for that power. So then also there's the option of monovision. Some patients will tell you, I don't want to wear glasses. So the surgeon can do the calculation during the preliminary test to compensate so that one eye will be fixed for to see perfectly in the distance, while the other eye is fixed to see close up. So this way, the patient can actually go about his normal business without needing glasses. But again, the drawback to this technique called monovision, which is also done with contact lenses, is that most times you tend to lose depth perception, which means if I throw a ball at you, ability to catch it will be a little tricky. Or again, your ability to judge depth between two objects is a little difficult with monovision. So if you're driving, you may not be able to actually predict the distance between you and the vehicle ahead of you properly. Then there's also the intraocular lenses that tend to compensate for bifocal type, which again gives you both distance and close-up. But these are little compromise, so you may still lose some vision. But these are the options that you have. Cataract surgery, it is not a big deal. Your surgeon has to be very, very lousy with modern day technology to do a bad job. I've seen cases, especially those that travel to third world countries to go have the surgery done because they can't afford it here, or in places where healthcare is not free, where the intraocular implant is just an approximation because they don't stock a lot of intraocular lenses, so they try to make do with what they have. So they use the closest to whatever prescription that they think you need. So in that case, you may end up still using glasses, or find that the vision is still a little blurry. But in Canada or in most first world countries, it's very rare for you to find cataract surgery complications as the way we used to have in maybe about 10, 20 years ago. So these are things that I felt we should all know. Cataract is inevitable. We'll all get it at a point in time. So we just have to prepare our mind that, look, this is what it is. It's not a big deal. You can't avoid it. So if there are questions that you think you need me to answer, please leave your questions in the comment section. Other than that, if you think you learned one or two things from the video, give it a like, thumb up button. See you guys next week. Thank you, and continue to share the video. We appreciate you all. Thank you.